Hi, my name is Keona Wilson, and I'm speaking for Group 6 with Cassandra Mccloud and Shania Mays. So, what exactly are electronic health records? So, let's think about how many times you have went to the doctor and had x-rays performed, got prescriptions filled, general checkups, and more. Have you ever wondered where all of that information is stored and communicated throughout our healthcare system? So let's think about it like a scenario that we can give for electronic health records. Imagine you went to the hospital for a mystery illness that has been bothering you for a while now. They had a series of tests to diagnose you, but unfortunately, not all of that information is shared with your primary care doctor. A week later, you experience the same symptoms. So instead of going to the ER, you head over to your primary care doctor to see if you can get the same medications prescribed. But when you got there, your doctor had no idea what medications you were talking about. Because the hospital doesn't use electronic health records, it was your job to inquire about paperwork regarding your illness. Now your primary care physician would have to do all the tests over again to see what illness you have, but she also had to do all of the paperwork over again. Wouldn't that have saved so much more time if the hospital would have just saved your information electronically? So, electronic health records, while in your community, when you visit any healthcare facility, information is recorded regarding the state of your health. However, many of the systems don't connect, making information a little difficult to communicate the status of the patient. That's why companies have adopted a more 21st century approach when dealing with patients. Electronic health records are a paper trail of patients' medical history. Okay. Electronic health records also enable quick access to a patient's history for a more coordinated, efficient care. It is in real time, so clinicians can use it at any time with no worry of it being not up to date. So for our group, we found that the healthit.gov gave 5 great benefits of EHRs. They improve patient care, increase patient participation, improve care coordination, improve diagnostics and patient outcomes, while also practicing efficiency and cost savings. Now we can consider how important electronic health records really are. If there is any time that you can't relay your medical history, professionals can access them at any time to help determine a diagnosis for you, the patient. Electronic health records are put in place to strengthen the relationship between physicians and patients. They can also help reduce any complications that may occur, as well as give patients a sense of security when visiting their healthcare providers. So are EHRs safe? Of course they're safe. They are within a secure network that only can be authorized by your healthcare provider, as well as you, the patient. So you can see any notes that your doctor may have on your record. You don't have to worry about your information getting into the wrong hands either. To explore more about the electronic health records, I recommend healthit.gov to further explain the benefits that come with them. Our group also found out that healthit.gov does a great way of explaining more to do with EHRs and how they are used in the healthcare profession, which was pretty cool. Also, we looked in our book some other ways that EHRs can help patients and physicians all around the United States. So for our conclusion, this scenario shows us how easily situations like this can be resolved as hospitals use the electronic health records. Instead of taking up all your time with the same tests and evaluations, the hospital could have sent all of your information to your primary care so they can do a general checkup to see if they needed to do a different approach. EHRs have helped the health community by giving them a smooth approach in keeping patients' records safe and secure through these records. As a person that is trying to get into the healthcare career, I consider this option being safe for everyone. I feel like EHRs are the savior of the healthcare system. And here are some resources that my group used to conclude our data. Have a good day.